Information overload. It's a phrase we are hearing more of these days as our exposure to a never-ending news cycle of COVID-19 continues to grow. It has become almost impossible to avoid the doom and gloom often connected to the story, as around-the-clock coverage of the virus has become the norm. But are people's concern driving the demand, or is the media fueling fear by exposing the public to it 24/7? I'm Ali Aslan. Welcome to Corona Times. Each week we look at a different aspect of how international media organizations are covering the pandemic. In this edition, we'll examine whether the non-stop focus on corona-related news is justified, helpful, or necessary. The three guests joining us today are uniquely positioned to discuss that question. But first, Adam Platz has this on the one story that has overruled them all.
The global outbreak of COVID-19 has...
The coronavirus has gripped the media like no other story. In March, news broadcasters reached record audiences, and mainstream media websites logged unprecedented numbers of visitors. But after weeks of round-the-clock coverage, by mid-April, news fatigue had set in, with media consumption returning to pre-virus levels. And perhaps that's a good thing. Research published in the Journal of Health Psychology suggests that repeated exposure to coverage of the outbreak can have adverse health effects. It says the stress and anxiety it causes can result in long-term physical and mental distress. And if the volume of coverage has been too much, its content has been equally criticized. As early as February, the Lancet Medical Journal published an article entitled "Toning Down the COVID Media Hype." But the news industry also plays a vital role in conveying health messaging and, when necessary, dispelling outright bad advice, no matter what its source.
Right, and then I see the disinfectant where it knocks it out in a minute, 1 minute. And is there a way we can do something like that by injection inside or almost a cleaning?
While disinfectant certainly won't help, the discovery of a vaccine surely will. And when it comes, that's at least one headline that everyone will agree is good news. Adam Platz, TRT World.
Well, joining me now to discuss this in Paris is Phil Chetwynd, the Global News Director for Agence France-Presse. As a special correspondent for AFP, he reported from several different countries, including the US, in the aftermath of 9/11. In Cardiff, Wales, we have Karin Wahl-Jorgensen, who's a journalism professor at Cardiff University. She's also the author of Disasters and the Media. And Philip Isle is in Providence, Rhode Island. He's a freelance journalist who has written on the subject of journalism and mental health. Phil, this is perhaps the biggest news story of our lifetime, of the century. For months now, the virus has been the number one, if not only, item on the news agenda. You're a very experienced journalist, have covered many stories, including 9/11, as we just mentioned. As far as the excessive emphasis on one story, have you experienced anything like this?
Well, I think the comparison with 9/11 was interesting because there was a period certainly after that where the whole issue of terrorism dominated the global news agenda. But I think it is pretty much without precedent. I think one of the interesting things that it really touches on every single area of journalistic activity. So it's not just a health story. It touches on sports. It touches on culture. It touches on science. So really, it's very, very hard to write or to cover any kind of story without there being an influence of COVID on that story. So it really is all consuming, and it really is a global story. Often we are accused of focusing on things that happen too much in the West or in the East or wherever it may be. This is a story that absolutely touches the whole of humanity. And I think that's what makes it all-encompassing. An
all-encompassing, all-inclusive, all-conclusive story here indeed. Karin, how have you been experiencing the non-stop wall-to-wall coverage of the coronavirus?
Well, I think it is obviously a topic of overriding importance and news value. And as Philip just said, it's something that affects the everyday lives of almost everyone in the world in an unprecedented fashion. But at the same time, I think it's important not to see it just as one discrete news story, but rather to see it as a major and defining crisis event, which actually informs the broader context for everything else that happens, and has massive social, economical, and political consequences, and will do for some time into the future.
Philip, you've been following the story, obviously, as we all have for the past few months now. What is your take? What is your impression as far as news coverage is concerned?
Well, I think that as Phil and Karin have said, this story is just unfathomably large. It touches every aspect of our lives. And it's a news story, it's a health story, it's a business story, it's a local story, it's a national story, it's a government story. And I think, unfortunately, in the US, we have a ever-growing climate of skepticism toward the news, unfortunately fueled by many of our public officials, including the president. So that puts news organizations in a difficult situation where they are reporting the best information, relying on experts, relying on science, and you have public officials at various levels, but including at the very top of the country, often giving out bad information, misleading information, information that could be detrimental to people's health. And we've seen that when the president spoke about bleach and disinfectant, you had poison control hotlines around the country responding to people who had unfortunately taken his advice. So it's a really fraught environment, and I think the work of news organizations remains as important as ever.
Absolutely. Disinformation, fake news, very important subject matter, obviously one we touched upon and looked at last week. But Phil Chetwynd, there are some people out there who may be thinking the news media is overdoing it. There might be an overkill. Do you think they are right? Do you think they have a point that the 24/7 wall-to-wall news coverage might be a bit perhaps too much?
No, I don't. I think it's very interesting that the people who accuse the media of going over the top and scaremongering, it's not the experts. If you listen to the people who throughout this crisis have had the most alarming points of view, it has been the scientists and the medical experts. The politicians has actually been often one notch below the experts. So I think for the scale of the story that we're covering, I think, it is totally justified. And I think one thing you have to remember, it's been very, very hard to put a human face on this story. Now, after the terrorism story in 9/11, I mean, when I was in New York, for example, I went to many funerals of victims, tremendous amount of emotion and so on. What you're seeing with this is there's no real human face on the suffering. Sure, we do reportages inside hospitals and images and so on, but we don't really see that much the full horror. Funerals take place in quiet, with nobody there. Many people are dying alone. So in actual fact, I think when you look at that, I think it's perfectly justified and understandable the scale of the coverage. And in some ways, as I said, the viewer is not seeing the full horror of what this illness is doing.
Karin, Phil says the wall-to-wall coverage of the coronavirus is absolutely justified, but it does, of course, have an effect on the news consumers, doesn't it? At the end of the day, the anxiety, fear, and panic out there is already quite high. Now we have wall-to-wall coverage, we have non-stop focus and emphasis on the story. What does it do to the mental health, perhaps, even of news consumers?
I think that, if anything, this pandemic has been a real moment of vindication for mainstream traditional media that provide reliable information and news. And I think that's particularly the case in the context of the rise of social media, where we see a lot of spread of misinformation causing what the WHO has called an infodemic. And I think that a lot of audience members will find themselves extremely alarmed by a lot of the misinformation that they see circulating, and that certainly does cause mental health problems. That's already very well established.
So it's the fake news, the disinformation that's causing it, but not the actual fact-based coverage. Do I get that correctly?
Well, I think that obviously, if we get exposed to an absolutely immense amount of very scary information about what is indeed a very scary situation, that kind of exposure does have an impact on your mental health. But at the same time, I think we also have to be aware of the greater dangers, perhaps, of the spread of misinformation, including from people like Donald Trump in the United States, so from very, very powerful political actors as well as users on social media. So I think we have to look at the totality of the media landscape. And within that context, the kind of crucial information that's provided by mainstream media actually plays a really essential role in information and actually giving audiences what they need to know about this pandemic. But at the same time, we do all have to be very cautious about the impact on mental health of consuming excessive amounts of very scary information at a very scary time.
Philip Isle, I think one of the key questions here for journalists like yourself is, how do you convey the much needed, much wanted, much required information on the virus without contributing to the fear and anxiety, without, if you will, absorbing to sensationalism? At the end of the day, you know, headlines like killer virus or deadly disease are not really helping here, are they?
Well, I think one of the things that I've seen as an observer during these times, which has actually been heartening, is that many major news organizations, newspapers, magazines, TV stations, radio stations have moved mental health coverage from the periphery really to the forefront. And I think that's one of the things that news organizations can and should do. I'm not sure they should necessarily tone down the severity of the reporting on the coronavirus, because look, it is far more contagious and far more deadly than the flu. In my lifetime, I've never seen a global health event like this. It's really scary, and it should be scary. There's no getting around that. However, I do think we have a responsibility to acknowledge to our readers and listeners and viewers that these are very tumultuous mental health times, that it's totally okay if you're feeling stressed and anxious and depressed, to use this as a moment to break down the unfortunate stigma around mental health that persists, and really to, as so many news organizations have already been doing, put those mental health stories right up front, right near the killer virus headlines. So they're right next to each other.
Phil, Chetwynd, picking up on that, do you think it's your responsibility, our responsibility, the media, the journalists, to focus also on the impact that our stories have on, say, the mental health of our consumers, or should that not be a consideration when covering such an all-inclusive, important subject matter?
Well, I think what we try to do in all our journalism is to be responsible and to put everything into context. We've spoken a little bit already about the wave of misinformation, a lot of it extremely scary and unpleasant for viewers and so on. And I think what is incredibly important is for the media to be present so as to put that misinformation into context, to debunk it, to make sure that there's always real information to counter the false information that's flowing around. And I think, you know, that's a very significant development in this crisis. I don't think we've ever had such a major crisis like this with this level of misinformation. So there's one of the reasons why we have to be present, and we have a very, very large team of fact checkers around the world. One of the reasons that work is just so important is because if the media isn't there contextualizing and trying to report in a responsible way on what's going on, there's a vacuum. And that vacuum is filled by the vacuum of social media. Some of them are bad actors putting out deliberate disinformation, but there's also just a lot of regular people passing on rumors, passing on fear, because there's a vacuum and because they're searching for solutions and searching for real-time answers and not getting them. So, you know, I think the role that we play as the media, as responsible, looking for well-sourced, clear, correct information, has really never been more vital than in a situation like this in a pandemic.
Karin, do you see perhaps the opposite effect that such a never-ending news cycle on one particular story is having, namely perhaps a fatigue, news fatigue, that people are tuning off, actually, are no longer listening and following it? Is there a danger that you see?
Well, I think that there's growing awareness again of the need to actually carefully monitor your media consumption. And so, for example, there is some evidence that certain people are deliberately avoiding news or restricting their news consumption to particular times, particularly in order to protect their mental health. So I think there is that danger, but at the same time, that has to be balanced against the overriding news value and importance of actually covering this pandemic. And that includes covering not just the disease itself, but also political decisions made around the disease, and to continue to hold governments and other decision makers accountable for their actions. So I don't see any way around what you refer to as wall-to-wall coverage, because that is the responsibility of the media. But at the same time, I think that there are steps that all of us can take to actually support our mental health by reducing news consumption when it does become a little bit too much.
Philip, Karin just touched upon this, the role of the media as a watchdog, making sure holding governments and politicians accountable. Now more than ever, this seems to be essential. How do you think journalists are doing? What kind of job are journalists doing on that front, as far as you can tell?
Well, I think as with before the COVID crisis, journalists, at least in my neck of the woods in the United States, have been doing a really admirable job under the most trying circumstances. I think it's important to remember that even before COVID hit, journalism in the US at least was facing a kind of dual existential crisis of this long-running economic crisis where you have newspapers and magazines shutting down or shrinking dramatically, and a growing political crisis where we have politicians feeling more emboldened to attack the press, attack the very notion of a free press. So even before this remarkable crisis took place, journalists were working in a very intense and stressful environment, and many of them being asked to do more with fewer resources. And I think they've stepped up to the plate, and they've been really doing an extraordinary job. We have various policies at the state and national level being made on the fly, and journalists are rushing to keep up with them and to try to keep an eye, for example, in the United States, of where this money that's supposed to be propping up businesses is going. I've seen all kinds of reports of millions of dollars going to companies and organizations that are already quite well off. And I think that's a proof that, journalists are keeping an eye and following the money, even in these extraordinary times.
Phil Chetwynd, do you think that one focus, exclusive focus on one story, is coming at the expense of many other important stories? At the end of the day, we don't hear anything anymore about Syria, the refugee crisis, if you will. There's a war in Yemen going on. Last time I checked, internal conflict in Libya, Venezuela, Hong Kong, you name it. All of these stories have disappeared, haven't they?
Well, they haven't totally disappeared, because the interesting thing is that for almost all those stories, there is a COVID element to it, and there's a COVID factor that is influencing what is happening there. You could say the same for the peace process in Afghanistan. The fact that the governments and authorities and so on are having to make plans and deal with the COVID element is also having an impact on those national stories. But I take your point, and I think you're probably starting to see a return of other news on the side in the last few weeks. I think certainly there was a period in March where really it was almost impossible not to have a COVID element to every single story that existed. But I think what we're starting to understand, and as we keep hearing the experts say, this could go on for months, maybe it could go on for years. And of course, the news starts to adapt to that reality as well as we come out of this intense sort of crisis moment at the moment.
Karin, we talked a little bit about how the news affect the mental health of those consuming it. What do we know about the state of mental health of those producing it? What kind of impact does this story have on us, on journalists?
Right. Well, I think that historically we've had this sort of assumption that journalists are objective professionals who are impartial, dispassionate, and able to kind of stand above the stories that they cover, that they're not actually affected by that reporting, because that ideal of objectivity is essential to the self-understanding of journalists and to their professionalism. However, I think in recent years we've seen growing awareness that journalists are in fact human beings who are affected by the stories that they're covering. And I think that's particularly dramatically the case with a story like this pandemic. And so what we're seeing now is that there are growing calls for frontline medical workers to actually get mental health support as a result of any post-traumatic stress they might encounter from their experience working in the pandemic. And in the same way, I think we will also see news organizations having to take responsibility for the mental health of the journalists who are covering the pandemic, because inevitably being on the journalistic front line of pandemic coverage is going to have a massive toll on the mental health of journalists.
Phil Chetwynd, has any one of your staff, members of your staff, come to you and say, this is getting too much, this is really having a negative impact on my mental health?
For sure. I mean, I think we're very aware of the mental health impact of this story. We've done a lot of work on mental health at AFP in the last 2-3 years, specifically understanding that people can be terribly affected by stories, and not just traditional post-traumatic stress war stories, but also just the pressure of real-time work, the pressure of distressing real-time work. And in particular, I think something that you'll see with the pandemic, which is also we saw with the refugee crisis in Europe, what I would call moral injury, when you see things happening in your home turf. We're very used to covering war and conflict and so on in other places. And then you come back home, and home is very safe and secure and so on. I think when you see that story on your home turf happening all around you, it can be very destabilizing. And I think the other thing you have to remember with this is that every journalist has families. Every journalist probably knows people who are suffering and ill at the same time. So we're dealing on this story in many fronts. So I think that there is a very, very serious mental health issue for journalists and also for the wider population. For the wider population, for sure. Karin, this story is going to be with us presumably for quite some time. This is not going away, unfortunately, this virus, that is. What would your advice be to journalists and consumers out there as far as how to proceed from now on in terms of producing but also consuming the news?
I think news organizations are already aware that one of the key principles of journalistic ethics is to do no harm. And I think that, in fact, the coverage of the pandemic has become increasingly sophisticated and sensitive to those concerns as we've gone along. And so I think, indeed, as has already been pointed out, for example, we don't see much of the graphic detail of what actually happens in hospitals and in terms of the fight against the pandemic. There are reasons for that in terms of the mental health implications. So I think that already we are seeing a growing awareness in terms of news organizations of how to handle this really unprecedented stories. In terms of audiences, I think that it is important to be mindful of the fact that on the one hand, it's extremely important to have information and to consume reliable information about the pandemic, but it's also important to be aware of how you're responding to that. And so if you're starting to feel a little bit overwhelmed, a little bit depressed, then stop looking on Twitter and stop watching TV and go and do something else for a little while. Perhaps restrict your news consumption to what is actually helpful for you and to what you feel you can handle on that particular day. And I think that this is all an ongoing and evolving process, but that we're actually starting to see growing awareness of how to deal with it, both from the side of the news organizations and from the side of audiences.
Valuable advice that you all have given us and that we are able and hopefully be able to convey to our audience. Phil Chetwynd, Karin Wahl-Jorgensen and Philip Isle, thank you so much for joining us. And that's it for this week's edition of Corona Times. As we examine the role and responsibilities the media has, we know that also includes us here at TRT World. So let us know how you think we are doing. You can follow our ongoing coverage of the pandemic, as well as other news on YouTube, Twitter, and trtworld.com. From me, Ali Aslan, and the team here in Istanbul, thanks for watching. See you next week.